I'm Jackie. I'm going to be your nurse. Can you tell me your first and last name for safety? Perfect. I'm going to go ahead and wash my hands, put gloves on. I'm going to let you know that I'm in here to do a full head to toe assessment where I'm going to use my hands, stethoscope, vision chart, as well as a few other things to do this exam. Are you okay with that? Perfect. Do you feel safe and comfortable? Awesome. Can you tell me where you are and who the president is? Wonderful. Okay, so I see my patient is going to be alert and oriented times 3. I'm going to look at their posture. I see that it is appropriate as well as their speech. I'm going to go ahead and say that they have good hygiene as well. I'm going to first assess my patient's head. So I'm going to go up, use my hands to look through their hair, make sure it's evenly distributed, make sure there are no lesions, no parasites, and that their hair is evenly distributed. And I'm going to check, I'm going to let them know that I'm going to touch their face. I'm going to touch a few different places on their face, ask if they can feel it, and if they can, I'm going to then move on to their movement. I'm going to have them lift their eyebrows rather. I'm going to have them smile, and I'm going to have them frown, and if they're able to do all those things and feel the movements on their face, I'm going to say that their cranial nerves 5 and 7, which are trigeminal and facial nerves, are intact. Now I'm going to go ahead and go in closer and look at their eyes. I'm going to look at their eyebrows and make sure that they're symmetrical. I'm going to look at their eyes, starting with their eyelashes, make sure that the hairs are evenly distributed on upper and lower lashes and covering out. Then I'm going to look at the sclera of their eyes, make sure that it is appropriate. It's white with no jaundice or redness noted, no lesions or drainage. I'm going to have them pull down their eyelids, look in their conjunctival sac, make sure that it is moist and pink with no lesions or drainage noted. I'm going to use my pen light. I'm going to start on one side, go in, around, back to the other side, and make sure that both pupils are equally reactive to light. I'm going to go ahead and while I'm close, I'm going to have them look at a wall behind me and then look at my finger. And I'm going to make sure that their eyes adjust with near and far distance, and then I'm going to say that they are pearl up because they are able to do so. And it's checking their oculomotor nerve, which is cranial nerve 3. Then I'm going to go ahead and have them follow my finger using only their eyes while I go in 6 different motions. And if they're able to do that, I'm going to say that I'm going to check for nystagmus, and if they're able to follow all 6 cardinal signs of direction, I will say that their oculomotor, trochlear, and abducens nerves are intact, which are 3, 4, and 6. Next, I'm going to have them cover one eye, and I'm going to put numbers around and see if they can tell me what they are. If they're able to do so, and they pass the confrontation test, and that's checking their cranial nerve 2, which is their optic nerve. Next, I'm going to move down to their mouth. I'm going to check to make sure that their lips are pink and moist, no cracking, bleeding, and I'm going to have them pull down their lip, check their gums, check for the same thing, that it's pink, that it's moist, no cracking, bleeding, discharge. Then I'm going to have them open their mouth, stick out their tongue, make sure their tongue as well as their uvula are both midline. And I'm going to have them say ah, and I'm going to check for a pendant shaped uvula and make sure it rises with phonation. If it does, I'm going to say that their cranial nerve 10, which is their vagus nerve, is intact. I'm going to continue assessing their mouth. I'm going to look at the roof of their mouth, check the mucosa, make sure that it is pink and moist with no lesions or bleeding are noted. I'm going to check their teeth, make sure that they are all present and no current dental work is ongoing. And I'm going to check their tongue, make sure that the top is rough, pink, moist, no drainage, lesions, or discharge. I'm going to check their the underneath of their tongue, their vestibular side, make sure it's shiny and smooth and that the vein is prominent. And then I'm going to have my patient swallow. If they are able to do all those things, if there's rise with phonation, they're able to swallow, and if everything that I checked is appropriate, then I'm going to say that their cranial nerves 9, 10, and 12 are all intact, which is glossopharyngeal, vagus, and hypoglossal. Then I'm going to move on to their nose. I'm going to make sure that their nose is symmetrical with their face. I'm going to check for nasal patency. So I'm going to have them cover each side of their nose, breathing in to check, make sure their nose is bilaterally patent. I am going to inspect their nose. I'm going to make sure that there is no drainage from looking straight at them, and then I'm going to have them let me look inside of their nose to make sure that there are no obstructions, foreign objects, bleeding, drainage, discharge, or tracheal deviation. No. Not tracheal. Looking for a word. Septal. No septal deviation. And now I'm going to move on to their ears. I'm going to make sure that their ears are in line with their eyes, and that and upon assessing the outside that there are no lesions, drainage, or anything like that. I'm going to go on each side. I'm going to look inside their ear and make sure there's no excess cerumen inside their external auditory area and no foreign objects on each side. And on each side I'm also going to pull on the pinna, push on the tragus, and check for tenderness. Then I'm going to do a finger rub test on each side, and that's going to check their acoustic nerve, which is their cranial nerve 8. Then I'm going to move right along and have them shrug their shoulders, and then push on my hand, and it's going to go against resistance to check their accessory nerve, which is cranial nerve 9. And then I'm going to check their lymph nodes. So I'm going to check their pre-auricular, post-auricular, occipital, their tonsillar, submandibular, submental, their anterior cervical, their posterior cervical, and their supraclavicular. While I'm checking it, I'm going to check for swelling, and I'm going to check for tenderness as well on each of those points. After checking the lymph nodes, I'm going to inspect their thorax, and I'm going to look at them from the front and the side to make, from front on and side, to make sure that the anterior, posterior, and transverse is less than the transverse diameter. Now I'm going to go ahead and check the rate, depth, and quality of my patient's breath. While I'm going to check the rate, I'm going to count for 15 seconds how many times that they're breathing, and then multiply that by 4 and get their respirations per minute. Then I'm going to listen to their breath sounds while I'm assessing the rate, depth, and quality. I'm going to check that they have equal chest rise and fall with each breath. I'm going to check the front, I'm going to check here, 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 and then about here and here for 8 different points. Then I'm going to check the axillary, right here and right here on each side. And then for the back, I'm going to go 8 different points going around the shoulder blades to check for their breaths posteriorly. So while I'm going back and forth, I'm going to use my hand. I'm going to use this part of my hand to check for fremitus. And I'm going to go right here, 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 here. And I'm going to have them, every time they feel me touching them, say 9, 9. And I'm going to feel the vibrations in my hand. And I'm going to check for heaves and thrill in the front as well. I'm going to, while I'm going from front to back, I'm going to feel for, I'm going to have them take a deep breath and feel for anterior, posterior, thoracic expansion. And I'm going to, in the back, check for spinal alignment to make sure that there is no scoliosis, kyphosis, or lumbar lordosis, where it goes in the lower part of their spine. And I'm going to check their carotid arteries. So I'm going to check each side, one side at a time. And I'm going to feel their carotid pulse. And then I'm going to use the stethoscope to listen to the bell part of their stethoscope, the smaller part. And I'm going to have them take a deep breath, exhale, and then hold that for 5 seconds while I listen and check for bruit on each side. And then I'm going to move along to their heart sounds. So when I'm assessing heart sounds, I'm going to listen right here for the aortic, the pulmonary, which are between the second and third intercostal space. And I'm going to go down to the fourth intercostal space. No, between the second intercostal space, I'm going to check for aortic and pulmonary. Then I'm going to move down to the third intercostal space and check for Erb's point. I'm going to listen to at the Erb's point, and then I'm going to move down to the fourth, check the aortic, pulmonary, Erb's. Aortic, pulmonic, Erb's, tricuspid in the fourth, and then I'm going to move down to the fifth to check the mitral. So aortic, pulmonic, Erb's, tricuspid, and mitral to listen to all the heart sounds. And I'm going to have them lay down flat. I'm going to assess their abdomen. I'm going to see if it's distended or if it's caved in. And then I'm going to start listening to each sound, to each quadrant. I'm going to listen to all 4 quadrants to check for bowel sounds to make sure that they are normal. And then I'm going to check for tenderness on each point. Well, I'm going to press lightly and then maybe a little bit harder to make sure that there is no tenderness in any area. And then I'm going to ask them about their urinary and bowel habits, if they're having any trouble with either, and when their last bowel movement was. Then I'm going to go ahead and go straight into their extremities. I'm going to have them sit back up. I'm going to check for both upper and lower extremities. I'm going to feel the temperature all around and make sure that there is no change in temperature and that they are warm, as well as no edema or lesions noted, and no tenderness in any area that I do palpate. Then I'm going to check for pulses in each area as well, and check for capillary refill. So I'm going to press their fingernail down and make sure that it regains color within 3 seconds or less in both fingers and toes. Then I'm going to have them stand straight up. I'm going to have their arms down by their side, and I'm going to have them close their eyes for 20 seconds. And I'm going to make sure that they're not swaying. I'm going to allow them to open their eyes, and if there is no sway, then they had a negative Romberg test. So I'm going to have them, while they're standing, walk to a given point and then walk back to make sure that that their gait is steady. And then I'm going to have them move their head from side to side, up and down in a circular motion. Make sure that their range of motion is a 5 out of 5. And I'm going to check their strength on all their extremities. So I guess I can have them sit back down, and then I'm going to have them squeeze my hands, push on my hands, pull, like push down, push up, and I'm going to do the same thing with their feet. I'm going to have them push up on my hand, push down on my hand to make sure that they are able to do so. And then I'm going to check their reflexes. So I'm going to check their triceps. I'm going to hit right here on both sides to make sure their arm goes out. I'm going to check their biceps and then their brachioradial on each side. And then I'm going to go down to their leg and right under their knee. I'm going to check their patellar reflex and then their Achilles, which is the back of their ankle. And then I'm going to check their plantar reflex. So I'm going to take something and rub it on the bottom of their foot like this and make sure that their toes curl inward. Then I'm going to check for, I checked all of their pulses. If all pulses are present, if there's no edema in any of the extremities, then I'm going to say that the assessment is done. So I'm going to have them get in a comfortable position in their bed, make sure that their bed is at its lowest setting. I'm going to hand them the call button, tell them to hit it if they need me. I'm going to ask them if they're safe. And if they are, I'm going to go ahead and open the privacy, wash my hand, take my gloves off, wash my hands, and then leave.